Hey everyone, in this chapter 12 video, we're going to discuss the healthcare or the economics of healthcare. Unfortunately, I'm remaking this video because my microphone was turned off earlier and I didn't realize it. This is chapter 12 in the 10th edition of Mankow's Principles of Economics, not the 9th edition, as my other videos are for. He added this after the COVID pandemic. The economics of healthcare is increasingly becoming more and more important as people research the COVID pandemic and healthcare premiums are rising, and so this topic is on people's minds more and more. We could certainly talk about this topic for an entire course, not just a class, but a course or more. I've taken singular courses on health economics before, and like I said, it's becoming even more important. Healthcare markets can deviate from the standard models that we've discussed before for supply and demand due to problems with information asymmetry and intermediary parties injecting themselves between the producers and consumers or buyers and sellers. We've talked about positive externalities in this course already. The COVID pandemic saw governments around the world subsidize and encourage certain activities like getting vaccinated because of their positive externalities. So why is the healthcare market special? Like I said, there are intermediary parties. So you've got normally your buyer and your seller, or your producer and your consumer. In the healthcare market, you have other entities like the government or insurers interjecting themselves between the doctor and the patient. There's also greater information asymmetry. If you've ever tried to read a medical bill or a health insurance policy, you realize quickly that it is not meant for you to be able to read easily, unfortunately. Also, there's a lot of information to know. You can go to school for 20 years and be a general doctor, but most of us haven't done that and are not going to. Uh, so it's hard to get the right information and to make sense of the information you're given by the experts. Healthcare providers are paid by someone other than the patient, the insurer or the government, that can distort behavior and incentives. And then rules established by the insurers rather than simple market factors can determine the allocation of resources. And so they may not act like they are in a competitive market. So all of these factors combine to make the healthcare market feel more inefficient. So a quick reminder on externalities. They arise when someone who's not party to a transaction is impacted by a transaction. If they are impacted positively, that's the result of a positive externality. In the case of healthcare, that would be herd immunity, where maybe you're immunocompromised or for some reason you cannot get a vaccine. Maybe you are allergic to the components. Then if the people around you get vaccinated, that helps protect you with that herd immunity. That's a positive externality for you, even though you did nothing to get it. A negative externality, however, could be if someone is smoking around you. That secondhand smoke impacting you is a negative externality, even though you are not the one smoking, you are impacted. The public being vaccinated obviously can yield positive results. So the government encouraged vaccination. They used Pigovian subsidies to get people to be vaccinated. So they would make it free to get vaccinated as a public service to make everyone else better off. It can be difficult to monitor the healthcare market, especially when it comes to the quality or effectiveness of the treatment you're getting, comparing doctors and similar services, or comparing people taking different approaches to solutions. That's difficult to make sense of, holding other factors constant, what is being more effective, what is being cost effective. And then determining who is at fault when something goes wrong can be equally difficult. Now, in theory, we could all self-insure, that is, save up money for an emergency so that if we are suffering a medical emergency, we can pay for that out of pocket. It can be difficult to do that. So we do consumption smoothing in another way. We pay premiums, which is like saving money, so that we transfer some of the risk to an insurer that we may get hurt and then have them pay for it. So we minimize our out-of-pocket expenditure, and otherwise we're paying money into a service and not getting anything for it. But we're paying for that consumption smoothing that I've talked about before. The cost of that consumption smoothing is the premium we're paying to the insurer. Now, moral hazard can arise if someone agrees with an insurer, hey, I'm going to buy this policy from you. You're going to charge me this based off of what you perceive to be my risk level. I will pay that premium to you. If after you do that transaction, you then take riskier behavior like bungee jumping or skydiving or being a guy in general, then that would be moral hazard, and that's generally frowned upon. Moral hazard can exist in many markets, not just the health insurance market, but also financial markets and elsewhere. Another issue for insurance companies is adverse selection, or the tendency to mix unobserved attributes, or for the mix of unobserved attributes to become undesirable from the standpoint of the uninformed party. So maybe you know that your parents have diabetes, so you're at higher risk to have that as well. If your insurance company isn't made aware of that, then they may charge you the rate that they would charge someone who doesn't have that increased risk factor, and that uh, is bad actuarially for them. So they may make an adverse selection by charging you a lower rate. The people who are most likely to use insurance, the people most likely to seek it out. So that's an issue with adverse selection. To help reduce this issue, they may screen potential customers for various risk factors so they can price accordingly. So I've talked about the Affordable Health Care Act making it easier for people with pre-existing conditions or higher risk individuals to get health insurance. So this leads to higher costs for insurers. To combat that, the ACA mandated everyone had to buy insurance to help reduce the risk pool. So they mandated that, and if you didn't buy the insurance, you would get charged a fine. The 2017 Tax Cut and Jobs Act reduced that penalty to zero. And I talked about this some in my lemons problem video, but this results in healthy people, low risk people exiting the pool and just waiting until they need the insurance to then buy it, since pre-existing conditions are now able to get insurance. And this leads to the risk pool getting worse and worse for insurance. So premiums going to have to keep on going up, and therefore that could lead to a death spiral. So you see premiums are continuing to increase faster than they otherwise would if not for the 2017 Tax Cut and Jobs Act reducing that penalty to zero. You can read a lot about this from healthcare economists that have been raising the red flag for this on a while. Meanwhile, politicians keep saying they're 2 weeks away from implementing a solution, have been saying that for a decade now. Sometimes you'll hear people talk about healthcare as a right, similar to food being essential to survive. What can be defined as a right is tricky, because are you entitled to a doctor doing work for you for free? How should that system be set up? There's a lot of disagreement on that. Should there be a single payer system or not? And if there is, what happens to wait times? Do they go up? How do we combat that? You'll hear discussions similar to people critical of other support programs like Medicare or Medicaid or SNAP benefits, wondering if it's worth the cost. I'm not going to tell you what you should believe, but you should be aware of the dialogue that occurs and why people argue what they do. You can see here in figure 1 your standard buyer and seller market structure differs from where we are here, where we have the insurer injecting themselves in between the patient and the provider. I highly recommend you going on YouTube and watching South Park's The End of Obesity, or the video Navigating the American Healthcare System. Even if you aren't a fan of South Park, that can be an amusing video, or frustrating if you've had to go through the experience before, as I have. So in this market, behavior is guided by financing, or who pays and how much do they pay. Access to healthcare tends to mitigate moral hazard. The insurer tries to limit access by requiring things like prior authorizations, automatic denials, in-network versus out-of-network coverage, review boards, etc. And then payments from insurers to providers. There can be disagreement on how much they're going to pay. Say the provider may say it costs this much, and the insurer is going to say, well, I'm going to pay you this much for it, and that arguing back and forth. Okay, let's go ahead and pause for the quick quiz, questions 1 through 4. Hit those yourself, pause, and then come back. All right, question number 1. The market for healthcare differs from most other markets because D, all of the above, because all of these factors contribute to this fact. Question 2, people buy health insurance to reduce C, uncertainty, because people are risk averse. Question 3, health insurance has access rules for patients to reduce A, moral hazard, because they do not want people doing more costly actions just because they know the insurance company is paying. Then question 4, if healthy people are less likely to buy health insurance, the market for health insurance experiences the problem of B, adverse selection, because unhealthy people are more likely to seek out insurance. Another factor to consider for health economists is how the market is changing over time and how the needs are changing for the healthcare system. People are living longer than they did 100 years ago. This changes the needs and the cost, and costs are increasing, not just because we have new, more expensive procedures, but because people are living longer and needing medical care for longer. So factors that can change the demographics of the country and influence cost and the needs of the healthcare system include how many children couples have. People are concerned about declining fertility rates in the modern Western countries. The ages that people start having children, because many are waiting until later in life to have children. The average lifespan and the death rate. As I said, we're living longer. Immigration, which can counter the declining birth rate, and then cohort size. So the boomer generation had a large cohort of people, but later generations that are supporting them are smaller by comparison. All of these factors have to be planned for by the government and by health insurance insurers to accommodate future needs, and by the systems that are set up to support us for providing health care. So as healthcare becomes increasingly a higher percentage of our national expenditure, it's becoming increasingly important to the public discourse. People want access to healthcare, but rising costs make that a challenge, and wait times. So one thing from an economic standpoint to consider here is that Balmer's cost disease describes how low wages and low productivity growth sectors like healthcare, so productivity growth is small there. Those wages must rise to keep pace with wages in other sectors, otherwise employees would go to those other sectors. So since productivity isn't increasing, you have to get those raises elsewhere, and that's by charging more. So that leads to further price pressure. Different countries have very different healthcare systems, and some countries are more proud than others of their system. Sustainability of the system is a large concern. Can we keep going, or will the system eventually collapse? Here you can see the United States compared to other countries in healthcare spending as a share of GDP. The United States back in 2019, before the pandemic, spent 16.8% of their GDP on healthcare, compared to a smaller percentage on these for these other countries, which may surprise you, since some of these other countries offer quote unquote free healthcare, single payer systems, etc. So you have to wonder about what we get for our buck versus what they get for theirs. Out-of-pocket spending is also declining as a share of expenditures. Some insurers, in fact, are pushing people to not use their insurance and to pay out of pocket. Some people say that may be so that those costs are not counting toward the deductible. So it's helping the insurance companies pay less in the end. And it may shock you to see, if you're told this medication will cost you $500 with insurance, but we're only going to charge $400 if you don't have insurance, or we're going to charge you $1,000 we're going to charge your insurance company $1,000 for the procedure, but if you went without insurance, we're going to charge you $5,000. How does that make sense? It's a real thing that happens. Health insurance in the United States is closely tied to employment. It's a form of golden handcuffs. That's largely due to the tax system historically, and it can keep people from leaving jobs and keep them stuck in jobs they don't want to be in because they don't want to leave and then suffer a lapse in coverage since you don't typically have your health insurance start on your effective date. It may lag for a month or two. Cadillac plans, or very well funded plans for executive types, are also something that is looked at. Since it can lead to overconsumption of healthcare, you may go to the doctor for every scraped knee you have and take away the doctor's resources from patients who need it more. Let's go ahead and pause for the quick quiz. This is questions 5 through 7. Please attempt those and then come back. All right, question 5. As a percentage of the economy's total income, U.S. spending on healthcare is much larger than it was 50 years ago and much larger than it is in other countries. So that is B. Almost cost disease arises in a service sector when the sector experiences, that's A, low productivity growth, since prices need to increase to keep up with wage increases in other sectors. And then question 7, compared with the past, Americans today are paying a smaller percentage of healthcare out of pocket. This trend increases the problem of moral hazard because if you're paying with someone else's money, then you're more likely to take risky behavior. Right. Papers will continue to be written about the COVID pandemic as we get greater insight into the responses and what was effective and what was not effective. As you read those, I recommend keeping in mind that it was unprecedented in our lifetime, and people were trying to do their best trying to save lives. But we didn't have perfect information, and so there were some decisions made that we'll get to learn from. Trilemmas can exist when you're trying to balance 3 different considerations, but it's difficult or impossible to get all of them, like wanting low cost healthcare, high access to healthcare, and also high quality. It's difficult to get all 3 of those. If you want low cost and high access, it's difficult to get quality. If you want high access and high quality, then it's difficult to get low cost. Right. The healthcare industry faces many problems moving forward as it tries to attract and retain talent, maintain supply chains, and faces a public perception that very different than it was in previous years. Some people suggest not becoming a doctor now because it's difficult to get reimbursed and you get so much debt accumulated for going to college. So that's very understandable, but we also need doctors and we should appreciate them because you're going to go undergraduate for 4 more years, then medical school for 4 years. You may have a medical residency for 5 years, a fellowship for 2 years, all of that while making a very low salary and having $300,000 in school debt. So that's something to consider. But the U.S. healthcare market is complicated. It can, as I said, depart from the normal market structure of supply and demand. There can be inefficiencies there. So it's complicated, and it's an area that will continue to become more and more important for good people to research and come up with solutions to the problems we are facing. Anyway, if you have any questions, comments, please let me know. Otherwise, I'll see you in the next video.